After the embryos develop and at least one is deemed viable, it is time to prepare the uterus for transfer.
So after your retrieval, of course, the next question is, when am I going to have my transfer? So ideally, we like to wait until we know that we have normal embryos to transfer, unless, of course, you're having a fresh transfer. Otherwise, you would contact us with your period and we would talk about your protocol. We would either put you on a birth control pill to allow us to have timing, a drug called Lupron, which also allows for timing and prevents ovulation. We have complete control of preparing your lining for the transfer. So depending on what the protocol is, we review that in detail with you, order your medications, make sure every consent is ready to go, and set you up for your transfer.
Either before the IVF process goes through, the ovarian stimulation, or after retrieval is you assess the endometrial cavity by either putting fluid inside of the uterus to make sure that there's no lumps, bumps, or abnormalities. Those are fibroids or polyps or irregular growths. You look at the lining to make sure that the lining is normal and regular. You make sure there's no fibroids around the lining that's changing the contours of the lining. And you also make sure that the fallopian tubes are clear. If you have fallopian tubes with fluid in them, which is called a hydrosalpinx, that can significantly diminish your chance of a successful transfer because that fluid flows backwards into the cavity and is toxic to embryos. But once you assess the cavity and you're comfortable that you have a good uterus, you're good to go with the preparation of the lining. The preparation of the lining typically takes 10 to 14 days as well. We give patients medications to grow their lining in a very programmed and structured and reproducible fashion so that the thickness of the lining gets to an appropriate state and so that the histology or the cell type within there represents the environment that normally would be there when trying to get pregnant on your own. There's lots of ways to do an embryo transfer preparation cycle. If the patient has regular cycles, you can let them grow their lining on their own. And then after having spontaneous natural ovulation, you put back an embryo a couple days later that's at the correct stage. But not every patient's the right candidate for it, because that patient may not make a lining that's thick enough in their own natural state. The next option that we can offer them is something called a programmed frozen embryo transfer or programmed FET. During this process, we give the patients medications in a very controlled and regimented fashion to grow their lining and to help grow it thick enough that it's appropriate for an embryo transfer. We then start synthetic progesterone. And what the progesterone does is it helps mature that lining to make it the right histology or cell type to welcome an embryo, to let an embryo stick.
All of the preparation, injections, monitoring, and lab work has been building up to this, the embryo transfer.
On transfer day, once the doctor is ready and embryology is ready, they wheel the embryo back in an incubator, just like you see in the NICU or on TV. It even has a little beeping noise, and they come into the room. Then they prepare the embryo, and you can see this all under the video, so it's kind of cool that you're able to see all that. And then obviously they make sure that we're identifying the right embryo to the right patient. At that point, the doctor then prepares you for the transfer. Similar to all the ultrasounds you've had done to get to this point, you will be doing an ultrasound guided transfer. All doctors do an ultrasound guided to help know exactly where they're placing the embryo. So you'll be able to see that on the video when they're actually injecting the embryo. So that's a really nice point where you're involved with the transfer.
It's kind of like starting off like a pap smear, right? So we place a speculum in the vagina and we visualize the cervix, which is the bottom of the uterus or the top of the vagina. And then through that very small pinpoint hole, we carefully introduce an embryo into the endometrial cavity or the lining of the uterus.
A lot of patients ask us if they can go back to work after the transfer, and that's totally up to you. It's whatever you're comfortable with. If this is your normal routine and you want to do that, that's completely fine. If you'd rather go home and veg on the couch and relax, that's fine too. Whatever's going to decrease stress is our best answer for you.